Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Zia Khwaja. I welcome all of you from MMK Hub platform. Today's lecture is Anatomy of the Mediastinum, which is a part of anatomy lecture, and this is an education initiative of MMK for the students to clear their concepts, divided into middle, anterior, and posterior portions. Middle mediastinum is in the center, in the mid portion, and the main content of middle mediastinum is the heart, while the anterior mediastinum is in front of the heart and posterior mediastinum is behind the heart. In next few slides, we will discuss in detail what are the structures, contents of the different portion of the inferior mediastinum. In the anterior mediastinum, it is bounded superiorly by the horizontal plane, imaginary line as we discussed earlier, which is passing through the sternal anther to the thoracic floor vertebra. Inferiorly, it is bounded by the diaphragm. Anteriorly, there is the body and xiphoid process of the sternum, and posteriorly, there is the heart. Means it is the portion of the inferior mediastinum which is in front of the heart. The main contents are thymus gland and lymph nodes. Right? Hope you understand what we are discussing. We have tried our best to make this anatomical description as simple as possible for you. Now the middle portion of the inferior mediastinum. It is located between the anterior and posterior mediastinum, and the contents are mainly the heart and the pericardium with their main vessels, that is the ascending aorta, pulmonary trunk, superior and inferior vena cava, right and left pulmonary veins, right and left phrenic nerve, and the lymph nodes. Means the main content of the middle portion of the inferior mediastinum is cardiac structure with associated great vessels and lymph nodes and phrenic nerve. Then the posterior mediastinum portion of the inferior mediastinum. It is bounded superiorly by the horizontal plane, as we already discussed. Inferiorly, there is the diaphragm. It is posterior to the heart. That's why the anterior border is the heart. And posteriorly, it is bounded by the thoracic vertebra, extended from the thoracic fifth vertebra to the thoracic 12th vertebra. And the lateral to the posterior mediastinum are the lungs and their pleurae. The content of the posterior mediastinum, as shown in this lateral view of this diagram, it includes the esophagus, azygous systems of vein. Posterior and to the right of the esophagus, you can notice the azygous veins. Then the right and left thoracic sympathetic trunk along the lateral border of the vertebra, then the mediastinal lymph nodes, and finally the vagus nerve. So these are the contents of the posterior mediastinum, which is the third portion of the inferior mediastinum, and it is located posterior to the heart. And the main content we will revise is the esophagus, azygous system of veins, thoracic sympathetic trunk, right and left, mediastinal lymph nodes, and vagus nerve. Other contents of the posterior mediastinum include the thoracic duct and the descending portion of the aorta, which is located posterior to the esophagus. Finally, this is all about the mediastinal structure. Finally, as we have discussed, the vagus nerve, the aorta, and thoracic duct are the important structure which is passing through the mediastinum. Just a few points of brief description of these structures, as these are the vital structures passing through the mediastinum. So we should have an idea of these structures as well. Vagus nerve. Vagus nerve is the 10th cranial nerve. It descends through the superior and posterior mediastinum. The right vagus descends to the right side of the trachea and form the posterior esophageal plexus and continues in the abdomen as the posterior gastric nerve. And the left vagus nerve, it descends between the left common carotid and left subclavian arteries. It forms the anterior esophageal plexus and continues in the abdomen as anterior vagus nerve. So the left vagus nerve, when enters the abdomen, it forms the anterior gastric nerve, and the right vagus nerve, when it enters the abdomen, it forms the posterior gastric nerve. Then the aorta. Aorta is further divided into the ascending aorta, arch of aorta, and descending aorta. Ascending aorta begins at the aortic orifice of the left ventricle. Its course is mainly in the middle mediastinum, and it ends as the arch of aorta at the level of T4. Then the arch of aorta is mainly its course is in the superior mediastinum, and it ends as descending aorta at the level of the T4. This is the same thing which we have discussed earlier, that the significance of the T4, that the junction of the ascending aorta with the arch of the aorta and the junction of the arch of the aorta with the descending aorta, both of these are at the level of T4. Then the descending aorta, the course of the descending aorta is mainly in the posterior mediastinum, and it ends as the abdominal aorta after it passes through the diaphragm. Finally, the thoracic duct. Thoracic duct is a main lymphatic drainage of the body. It begins as a continuation of the cisterna thalli at the level of the number 1 vertebra. And cisterna thalli is basically draining the lymph of the lower limb as well as the abdominal cavity. And when this cisterna thalli crosses the level of the number 1 vertebra, its name changes to the thoracic duct. It enters into the thoracic cavity. Then it passes through the aortic opening of the diaphragm, and it ascends in the posterior mediastinum, posterior to the esophagus. Finally, it ascends in the superior mediastinum to the left of the esophagus. Its tributaries are mainly lymphatic from all of the body except the right side of the thorax, right upper limb, and right side of the head and neck. As you can see in this diagram, that lymphatic from whole of the body, the lower limb, abdomen, left side of the upper limb, left side of the chest, and left side of the head and neck is drained via the thoracic duct, while this portion is spared because its drainage is not via the thoracic duct. And finally, this is the drainage of this portion, which is not drained by the thoracic duct, is via the right lymphatic duct. And then these right and left lymphatic duct, or right lymphatic duct and the thoracic duct, finally open in the left brachiocephalic vein. That's all about for today's lecture. Hope you understand. If there is any query, any problem, you can discuss with us on our WhatsApp group as well as our Facebook page or our website. Inshallah, see you soon in the next lecture.